So here we are. It's about 11 a.m. It's day one after surgery. I'm due for another dose of meds, so I thought maybe now would be a good time to make this video rather than waiting until after. So I have an ice machine, which is running nonstop. I did sleep with the ice machine on last night, which, because there's a wrap underneath of the ice of where that is, it it doesn't, I don't feel it that much, but again, supposedly it does make quite a difference. So had an ACL reconstruction yesterday with Banff Sport Medicine. Dr. Kopka was my surgeon. She was absolutely wonderful. The anesthesiologist and the entire crew there was awesome. Felt like there were lots of friends in the room, which is great. Basically had the spinal block, and that came out quite quickly. So I had a fair amount of pain at the hospital yesterday, was given some medication, given a morphine shot as well, and then sent home because I was ready to go home. I felt supported there. One of the neat things is I have read through all of the frequently asked questions on the Banff Sport Medicine website, but they also send you with some of these, I guess, little worksheets. Well, I don't know if I would call them worksheets, but they're, pain control after surgery. So that's really important. Post-operative concerns. So here, talking about when to call the hospital and when to call the clinic and ask, for help. Information, obviously, about narcotic drugs. Discharge, managing pain after surgery, after spinal anesthesia, and after a nerve block. So that's all really helpful, because I think when you're in the hospital yesterday, you're nervous or you're trying to absorb all of that information, but here we are today, and I don't remember most of what I was told yesterday. So it's really good that they send you home with all of this information. And I did this morning go over, and last night as well, go over to the Banff Sport Med frequently asked questions, just to kind of find out, what to expect with Percocet. I was quite sick last night to my stomach. I think that's probably from the spinal more than anything, but again, par for the course, I guess, here. So yeah, so I think that covers everything. Trying to take in lots of fluids, eat lots of healthy food, and I do have crutches that obviously I can get myself around the house on, but I'm not going very far. I really am just gonna stay here and look out the window and enjoy that view and keep that ice machine on. So I think that's it for day one. Thank you. Hi, it's day 5. I just took the bandage off and had a shower. The gauze was quite stuck to the steri strips where the incisions are, and as a result, I just let the water kind of run over it, and then was able to kind of easily peel the gauze off, so the steri strips were still intact. I left it open to the air. I have a lot of questions about weight bearing and just going by feel versus doing what I'm supposed to. So I feel like I can start to weight bear with the crutches. I feel like I could start to hobble even a little bit without the crutches. So my questions are just purely on trying not to screw anything up. I've reviewed all of the materials that were sent home with me again. I've, been on the Banff Sports Med website again, reading those frequently asked questions. And I feel like I could definitely use some advice at this point. So I'm glad I have a physio appointment booked for next week. And I'm anxious and excited to get going. The swelling's not as bad as I thought. I don't have much in the way of ankles, or at least on that leg. But otherwise, yeah, things are, I think, going as they should be and pretty good. And in terms of medication, I am mostly, I would say, off the painkillers. I did take one last night just to help me sleep, but I'm just taking Tylenol and ibuprofen now, trying to make sure I'm completely off those painkillers because they make you feel kind of funny in the head. So anyway, that's it. Thanks. Day 5.